Today, the vampire facelift. Is it only for the undead? Hi guys, I'm here today to talk to you about platelet rich plasma. What is it? Where do you get it from? Where do you use it? And should you have it done? All big questions. First of all, platelet rich plasma is from your blood and it differs slightly from platelet poor plasma. So you've got PRP and PPP, not urine, and you should definitely not use urine on your face. Platelet rich plasma contains a very high number of platelets, whereas platelet poor plasma will contain more platelets than your regular blood does, but just not as much. So what's in it? Both of them have got an increased number of platelets. And the interesting thing about platelets is when you activate them, or even when you don't activate them and they activate themselves, they release lots of different growth factors into the tissue. These growth factors would be things like platelet-derived growth factor, transforming growth factor, interleukin, platelet-derived angiogenesis factor, vascular endothelial growth factor, epidermal growth factor, and insulin-like growth factor. What on earth does that mean? Well, basically these are things that stimulate your body into renewing itself. So when you cut yourself and you have platelets going to that area to help with the healing process, they would release some of these factors into that area and it would encourage new cell growth. So you're basically trying to harness the fact that platelets are used by your own body in healing to cause tissue regeneration. PRP was first used in patients with skin problems like non-healing ulcers or burns. Now we use it for other things in medicine, like you might have heard of sports people using it for injuries, particularly tendon injuries. It's still used for helping with the healing of burn tissue, and we use it quite a lot in implants, like in oral and maxillofacial surgery, where you have to place a bone implant, for example. So how do you get it? Well, as you can probably imagine, it's from blood. So we take one fresh vampire and I'm just kidding. No, we just take your blood. So just in the same way that you would have a normal blood test, we identify a vein and we just take some blood from that vein. And that blood is then put into a centrifuge or something like a centrifuge, depending on which system it is that you're using. So most PRP systems, they'll spin your blood round in a centrifuge, and because of the spinning motion and gravity, all the heavy stuff like the red blood cells will sink to the bottom and then the platelets will rise to the top. So that's why when you take the PRP out of the centrifuge, it's split into two levels. You might have seen online people like Kim Kardashian having the vampire facelift or the vampire facial, and she's got what appears to be blood all over her face. Well, actually PRP doesn't really look like that. It's normally a lot more yellow and straw coloured, so I suspect that that was done just for the effect. Where we use it depends on what we're trying to do with it. So the vampire facelift that you might have heard of involves the use of PRP with lots of tiny little injections all over the skin. In that technique, you're placing it very, very superficially, like a mesotherapy sort of technique. You can also needle it in using either a derma roller or a derma pen. Another option is to inject it deep into the tissues. So some people like to inject it deep onto the bone because they say that it can help to slow down bone remodeling. So as you know, as you get older, your skull changes shape and it shrinks. Now, there's no evidence that PRP can actually stop this from happening, but in some systems where you get an awful lot of PRP and you've got lots to spare, then hey, you may as well use it for something. You can also use PRP in the hair if somebody has either a patch of alopecia or generalized thinning hair. It's not a substitute for a hair transplant though, if you have got male pattern baldness, for example. You may also have heard that you can use PRP down there for procedures like the O shot or the P shot. I'm pretty sure you can imagine what they would be. So what machine should you use? Well, it really depends on what it is that you're trying to achieve. Most of the centrifuge machines will concentrate the baseline of your platelets about 2 to 3 times. And what that results in is really PPP, or platelet poor plasma. You could also call it platelet conditioned plasma, which is fine. I still use this, especially in areas where I just need a very small amount. It's a much more cost-effective way of harnessing these growth factors than using some of the more expensive machines. So the one that I use to get this particular type of platelet solution is called the Arthrex, and it's a centrifuge machine, so it spins it. Another option is to use something like the Angel system or the Magellan, which uses different types of light to push the cells one way or the other, which is pretty fancy when you think about it. So you can push away specific blood cells depending on their size and volume, which is pretty amazing. And with that, you tend to take quite a lot more blood. So for example, with the Angel system, the one that I use, you can take between 50 and 100 mils of blood, as opposed to the 15 mils that you can take with the Arthrex system, which translates to you getting between 3 and 10 mils of platelet rich plasma and then about 20 mils of platelet poor plasma, which means that you end up with really a lot more liquid than you really know what to do with. In those situations, I like to use the platelet rich plasma in the specific area that the patient's concerned about, whether that be a patch of hair loss or maybe crepey skin around the eyes. We can also use it for dark circles as well. And then with the platelet poor plasma, I'll maybe sort of do a mesotherapy technique all over the face and neck, or perhaps put it into the hair. Sometimes we just throw it away if you're feeling particularly extravagant. The Angel system can concentrate the blood to about 18 times the baseline level of platelets, which when you compare it to 2 to 3 times, it's quite a bit more. And you get more product as well, however it's quite a lot more expensive. In terms of time, some of the centrifuges will complete their cycle in about 6 minutes, whereas something that uses light, like the Angel, normally takes at least 20 minutes to actually get the product that you need to use. So it's a much longer process. Then there's the question of whether or not you should activate your PRP once you've got it. So some people like to add a substance in there to activate the platelets and make them release the growth factors more quickly. Personally, I don't like to do that. I'd rather just leave it be. I'm not sure that there's enough convincing evidence for me that activating it will really make that much of a difference. And clinically, I found that the person gets quite a bit more swelling if I'm doing it for the eye area. I don't really mind so much if I'm using it, for example, in the hair or like a mesotherapy technique. But my technique for adding PRP underneath the eye is to use quite a lot of product there, and you can sometimes get quite swollen afterwards. Something else that people think about with PRP is should they add thrombin or not. So if you want to create like a jelly-like substance, literally like a jelly, like wobbles, you can add something called thrombin into your PRP and it makes it start to coagulate. Some people use that instead of a filler, like they'll fill their nose to... Another controversy with PRP is should you add thrombin to it. So you would add thrombin if you want to create like a jelly-like substance, which some people use like a filler. So for example, they'll fill the nose to mouth line using this activated thrombinized PRP, which is like weird, mushy jelly. However, Although it looks good at the time and you've managed to fill out the area, it literally lasts for a couple of days before your body then absorbs it. So I think it's kind of a waste of time. If you're going to go to all that trouble, why not just fill it in the first place with hyaluronic acid, which is something that you have in your body anyway. Generally speaking, you need to do more than one treatment session with PRP to get the best results. So typically around the eyes, I recommend doing between 2 and 3 treatment sessions to get the final result, and then you would maybe do another one after about 6 to 12 months to keep on top of it. Let's just have a quick look at somebody having PRP done. So this lady, we've used the Arthrex system, and we're just gonna inject with a cannula underneath the eye. She's got a lot of fine crepey lines underneath there, and the hope is that the PRP will make that skin a lot less easy to wrinkle up. Let's show the afters. Although this was only one treatment session, she should really have 2 to 3. It gives you an idea of how it might look eventually. Okay, so that's it for today. Let me know in the comment section below if you've had PRP before or if you're considering having it done. Join me again next week for more treatment talk, and don't forget to like, comment and subscribe.